Great. Hi, everyone. Welcome to House Healthcare. It is Tuesday, January 9th. And we have kind of a lot of little things, well, not little things, a lot of short segmented items on our agenda this afternoon. We're going to review the fiscal notes with Nolan on the two compacts we have. I'm going to talk about a project we need to do. I'm hoping to get some volunteers to do it. I'm going to go over some of the reports I sent you over the weekend. I was sending a lot to let you know what is good to read for testimony that's coming up. We're going to hear from Jill Olson of the VNAs for a budget adjustment request. We're going to hear from Bobby for a quick update of what he heard in the Education Committee. And then I thought we could have a conversation about the testimony, the joint testimony we had on Friday with House Corrections. I can put a little bit more context around it and we can just talk about how we thought it went. So with that, we have Nolan with us from Joint Fiscal Office, and the fiscal notes are on the webpage, right? Great.
Yeah.
Go for it.
For the record, Nolan Langwell, Joint Fiscal Office. I'd also like to introduce the newest member of our Joint Fiscal team, Logan Newberry.
Hi, Logan.
He's going to be doing transportation, but I invited him to watch and learn what not to do on the stand.
That's really good when you're watching Nolan. Pay close attention. But welcome.
First thing is to be prepared, which I'm not. Also, for the record, I'm not Mike Fisher. Who's probably watching. So you have two fiscal notes. I'm not going to put them on the screen. I'm going to assume you have them in front of you, that you've read them, memorized them, and know. I'm just kidding.
What not to do.
Yeah, what not to do. I'm going to start with H247. That is the occupational therapy licensure compact. I have a lot of background information in here in terms of how many people we have currently licensed in those particular categories, and how many of those people fall into states that currently are in states that have passed licensure or have legislation pending. I'm not going to get into the weeds of the methodology. I'm just going to kind of summarize what's in them. There's a couple pieces in here that have fiscal impact. The first is the loss of revenues from the licensure fees and the loss of revenues from the application fees. They're different. But the licensure fees, licensures are, in Vermont, the OTs and the OTAs, so the occupational therapists and the occupational therapist assistants, right? Mm-hmm. They renew biennially in May of even years, and that fee is $180. So it's $180 biennial.
So that's the table. I know you don't know, but that's
Yes.
the table on the first page.
That's the table on the bottom of the first page. And so what you'll see, and I don't have it pulled up, but if you're looking at it, you'll see the table. I break them out. I don't, maybe Claire, could you actually pull that up and put on the screen? Is that possible?
Or is it on the website?
It should be on the page for
It
today.
is. Go to our committee, not joint fiscal office, but our committee.
What I've tried to do in this chart is to break out, so you have the number of OTs and the OTAs, which is the same fee, and then how many of them
This is the fifth.
are out-of-state folks, because that's for the revenue losses and the folks from the out-of-state.
Refreshed it.
How many of them are from states that have already joined the compact, and how many of those are from states that actually have legislation pending? Okay, if you can just scroll down to the bottom, no, can you go
The first one.
the bottom of the first page? Yeah, perfect, right there. A little higher though, maybe. A little higher, the other way higher. Can you, higher? Just, I want this chart above my head. There you go, perfect, thank you. And so this is just taking into account point in time. So this is taking into account how many of the folks that we currently have from out of state that are either from compact states or states with pending legislation. That could change. Some of the pendings could become actuals, and some of the pending there could be more states that are pending. What we did is I did a range. And I said, okay, if you're just looking at, if we did it tomorrow and it was to be enacted tomorrow, which it wouldn't be enacted till fiscal year 26, but let's say it was till tomorrow. And the people that are from the current compact states, it would have a $19,000 impact. if all the states that are pending became signed on to the compact, by the time we go into it, then you add another 15,000. So it'd be 34,200. So that's kind of to give you a sense. That doesn't take into consideration between now and when this passes and it gets enacted, other states that may join the compact. But this gives you a sense of the lost revenue. And that's biannually.
Okay, so let's hold on to that. Everyone, that makes sense to everyone? So these are people who have licenses from states that are already in the compact, or where legislation is pending, that if we join and do this, we would lose this revenue because they would no longer have to get a full license in Vermont. Did I say that right?
Yes.
These people are already working in Vermont with a Vermont license.
Yes,
Okay.
correct.
From out of state.
And so it's the
From out of
loss.
state.
So it's the loss of that revenue for
Right.
those people.
Right.
Exactly. You got it.
Melissa?
And I'm afraid, I'm sorry if I missed this. Wasn't the OT compact one of the compacts where we actually could set a fee that?
We'll get to that.
Okay, never mind.
We'll get to that. But yes.
Okay.
If you can scroll, Claire, just to the chart on the second page. The second revenue loss is the application fees. Again, same methodology. These are annual. So the low end of the folks, we're just talking to the folks that are in just the current compact states versus everyone else. We're looking at a range of $3,400 to $4,800 in lost licensing fees. And I just kind of
Application fees.
applications fee, thank you. And I just kind of do a high, low, and then I also make it clear which is biennial and annual. So this gives you a sense of that range. Now, to Representative Black's point, yes, this compact, some compacts allow for there to be a state privilege fee so that the states, we could charge out-of-state folks a fee to have a compact in Vermont. Some of the compacts allow that and some do not. So this compact allows it. The social work compact actually does not.
We call this a privilege. I got a little confused on that. So this would be a privilege.
Privilege
This is a
practice
privilege
fee.
compact. Okay.
And so if this one allows it, so that is something that the Ways and Means Committee will decide on. They were the ones last time who, through our testimony, came up with, if it allows a fee, they will do $50. So for all the compacts that we've passed so far, that allow for privilege fees, we have passed the $50 privilege to practice fee on that. So I suspect that they will be considering that when we take this across the hall. The last fiscal, sorry,
So Nolan, if the fee is allowed, where would that money go? To?
it would go to OPR.
States?
No, so if we do a compact fee, I assume that money, the $50 we get would go to OPR to help offset, I believe so, to help offset the lost revenues.
That's in the Secretary of State's office?
Yes, they have a special fund. All the special funds are managed
Is
there.
that $50 fee that they've sort of set on all of the compacts, is that actually based on any sort of administrative workload, or is it just a dollar amount they threw out and said, let's
It's
do
based
50?
on, if I recall my own testimony from last year, I looked at some of the compacts that had been established. I don't remember which ones they were. And there was a range of some were charging nothing and some were charging this, and $50, I believe, was the midpoint. And they said that seems fair to help offset the cost. So it was based on information that I provided to them last year, and they were going with the middle.
Do we have any financials yet for any compact? Because we're in a nursing compact already for a
So
while.
they all just went into effect. So I think there takes some time and they have to finish the cycles. So I don't know where we are. That's a question for the Secretary of State. So have any of the compacts we passed, are we in them yet? I think the answer is probably not yet, but that's a question for the Secretary of State's office.
When did we do the nursing? That's been in place for years.
Oh, last year.
We did it a while ago, but it takes a while to be implemented. And we do have a report coming from the
Okay.
nursing one.
Okay.
I just don't know when we're getting it. Art?
Yeah, just a question though. Application fee versus licensing fee. You probably just spoke to it, but I'm trying to understand why what the license application fee is as opposed to the licensing fee, or why we have two fees.
That's a question for the Secretary of State's office.
And so somebody that wants to practice this type of medicine or, procedures gets a licensing fee and they also get an application fee?
I believe they would have to pay an application fee to apply,
Okay.
and then they have to pay their licensing fee after that.
If they get a license, then they pay a license fee, but the application fee is like, start the process.
Okay.
Again, I would.
Yeah, all right, I see.
Then
So
it-
so that they're not wasting their time on something where you don't, yeah.
Right.
All right.
Right, and there's work and cost associated with looking at the
Right,
application.
so that's what I
itself.
mean.
Right,
All
yeah,
right, yeah,
yeah,
I got you.
okay.
The other piece to consider is that states, now every compact is different. Each compact has a commission. Or you'll see with the other one, there's no commission yet because there's not enough states that are in it. But the commissions then can set fees for the states to pay to be part of that compact. We don't know what that fee will be, but we know it'll be nominal. I remember speaking to one of the compact folks from last year, and I remember being in like the $1,000 to $2,000 range. So it was pretty nominal, but the fee that the state itself would have to pay to the compact, and that's to help them operate their compacts. But again, I think that will be nominal. Then the last piece I want to just flag is this is like a little note that's been added to every one of these compacts in terms of that, one, this does have a fiscal impact in the aggregate to the Secretary of State's office. They will need more IT and staff to process these fees. The number that has been spoken to me is around $10,000. I don't know if that's for all of them individually or all together, but again, it's a question for them. And just a reminder that the special fund in the Secretary of State's office is still operating at a deficit. So I don't have the information on that, and that'll be more information for the committee across the hall, that I'll have the information for them. But this is all the fiscal pieces that I just sort of wanted to flag for you.
Can you remind me, I'm sorry, I'm conflating all these compacts. Is this one of the compacts where when people apply to their home state, they will be applying for a compact license, or they will just be applying for a regular OT license here and then they apply for the compact through the compact? Because couldn't we charge differently, like a higher fee? Couldn't we set a higher fee if you want to be a compact license for the home
I
state?
think the answer, I would defer to Secretary of State's office again. But what I can say is that, I believe we still would charge a fee for our in-state licenses. And what we did last year was to offset some of the revenue losses. We increased fees across all the occupations, or should they, you did, the legislature did that. So we still have some influence on that. We don't control what the compact fee is. And all the compacts, as you know, are the same across the states. But I would defer that question again to the Secretary of State's office. I had asked them to be here.
Yeah,
Lauren,
she's here. So Lauren,
Okay.
are you there? Can we take down the,
okay, I couldn't see her.
hi, Lauren, welcome back.
I specifically asked her to be here so I could phone a friend if these questions come up. Thank you, Lauren.
Thank you. I apologize for being late. I thought it started at 1:30, but I'm seeing it start at 1:15, so I apologize.
Oh, no worries.
Lauren Lehman, with Office of Professional Regulation, General Counsel. To the last question, so this model, the OT model, is a privilege model where the state gets to set a privilege fee that's separate from the in-state license fee. So our in-state licensees would pay for their home state license, same fee we charged that you updated last year. And then they would take that home state license to the commission and say, I want a privilege to practice in Maine, New Hampshire, Massachusetts. And they'd pay a specific fee for each of those states for the privilege to practice in those states. So for out-of-state folks who have a home state license in Rhode Island, Vermont can set what our fee is for practicing, for the privilege to practice here. I think we did it at $50 last year per compact.
Am I imagining that there are compacts, and I understand this is not one of them, but do we have compacts where when you're applying for a license in your home state, you have the choice to either apply for a home state license like we do all licenses, or you can choose to apply for a compact license
Right.
through your home state and then deal with the compact for your out-of-state things. Am I imagining that?
No, I don't believe so. So there's another model called the multi-state license model, which the social work compact that Nolan will be talking about and the nurse licensure compact follow, which is instead of getting a home state license, you get a multi-state license, and that then you can practice in any other state without notifying anyone, without paying for a privilege. You pay upfront the cost of that multi-state license, and that is your sole fee.
Okay, so theoretically, we could charge more for that license than we would a regular social work license if you're just practicing here.
So
They're
if you,
two separate licenses.
yes, you could charge more for that multi-state license if you were looking theoretically to get to make up for the costs of that.
I guess and I know you don't administer the physicians, but I think the physicians compact, they apply for a actual
Abbreviated.
compact license.
Yeah, the IMLC, they have to, it's kind of a mix. So they have to apply for a license in each state they want to apply to practice in. It's just an abbreviated application process, but it does allow the state to charge for each of those. It really is just who's, I think, bearing the cost. And within Vermont, we have, the structure where the licensees bear the cost of the regulatory structure. So the multi-state license, in-state licensees have to cover the cost of that program. With the privilege, it's out-of-state folks who pay a fee to practice in each state and are covering some of the costs. Other states, it all just depends on the financing model for the licensing agencies.
Ellen?
Do the current licensing and application fees go to OPR as well?
Did you hear that, Lauren?
I didn't.
Do the current licensees and application fees go to OPR?
Yes, and they're all, depending on if they're advisor or board model. If they're board model, they go to a professional regulatory fee fund. Each profession on the board model level needs to fund its own regulatory system so its licensing fees are set at the level necessary to fund that. An advisory profession where they don't have an independent board, they pool the costs, but again, it's paid for through licensing fees. It's not through any other outside appropriations.
All right. Thank you, Lauren. Oh, sorry.
I don't think, Lauren, that I understand what the specialty fee fund is. Does that exist?
I don't know that there's a specialty fee fund. There's a professional regulatory fee fund that I was just referencing, and that is the fund that funds OPR.
I think what you might be conflating that with is we call that a special fund. So we have a lot of special funds. And as a matter of fact, if you go to the legislative reports, there is a list of all the special funds that we have, just I believe over 100. And what the balances are. So maybe that's what
That's, I think, what I'm referring to.
yeah, and if this is one of
Well, just so that I understand, how does a special fund have a deficit?
well, I guess that's a great question. I guess the way I would define that in this case is that the fee revenue does not cover the costs of the program. In the case of OPR, they are operating, correct me if I'm wrong, completely off of fees. I don't believe they get general fund dollars to operate this program, or traditionally have not. So the cost to operate the program exceeds the revenues that they get to.
They take it to the special.
Those special funds, how they pay for it and how they cover those costs, I couldn't tell you. But Lauren, am I correct in that you don't get general fund to operate these programs?
We do not. And so we've received I think one or two special distributions from the general fund when for specific projects. But at this time, and the other factor is the fees are set by the legislature. So we haven't always been consistently asking for fee increases. So there's a deficit in how much we're able to charge people for a license to practice without pricing them out of practicing their profession, and what it costs to administer the program. And the fewer licensees we have, the fewer have to bear that cost, because the cost doesn't necessarily go down when the number of licensees goes down.
And this conversation that we're having will be had in government ops and ways and means about, as we move more and more into these compacts as a way to do business and help our workforce and help gain access for Vermonters. We've got to look at a better way to fund OPR to be able to do their important work. So again, that's not a conversation for this committee, but it will be happening elsewhere. Alyssa, and then we're going to go to social work.
I just kind of to that point, I know we raised a lot of fees last year, but even specific to this OT, when's the last time that these fees were actually raised? Prior to, I think, last year.
It varied. I think we had a bill in 2019, one in 2017. Some hadn't been updated since I think 2003. So there was a wide breadth, and there was a significant number that hadn't been updated in about 15 to 20 years.
Thanks. Great. Thank you, Lauren. All right, social work.
Okay, social work. So the revenue impact is going to be in the same four areas. It's going to be licensing fees, application fees, the practice fee, which there isn't in this case, and then the fee the state pays the compact. So just that the state will pay to the compact. So I'm just kind of breaking down those four boxes that I sort of notched off last time. So if you go to the second page, do we need to pull it up again?
Yeah, I think we're good. I think now that we know how to break
So if
it
you go to
down.
the top of the second page of this particular fiscal note, you'll see I have a chart with licensing fees. It's broken up into multiple categories. I have the LICSWs, the licensed independent clinical social workers, and the licensed master's level social workers, broken out by those from a compact state, which in this case is just one state. It's Missouri. I had written Michigan in an older note. That's why it says MI and not MS. I need to fix that.
MO, it's not even MS.
No, that's right. MS is yes. MO, so I have to fix that. And then you have from states with legislation pending. And when I spoke to someone from the association yesterday, I was asking them some questions. They went on the website like, oh wow, it's a 20 now. So their point is, wow, it's even growing faster than they can. And now keep in mind, what happens is you have a group that puts together a master compact plan, right? And then the model legislation. This model legislation wasn't completed until February of 23. And it was late in the year that most states couldn't even introduce bills till this year.
Right.
So that's why there's only one state to date. But the fact that you have 20 already kind of goes to the point of how quickly states are adopting this, because social work is a big field. And as a result, we have a lot of social workers in the state. And as a result, you'll see the fiscal impact of this one's a lot higher than the occupational therapists. So I used a point in time, by the time you pass this bill or comes to the Senate, there could be 23 states or 25 states that have pending legislation. And by the time you pass it, there could be 7 other states that have passed it. So I'm using point in time. And so if we just say, okay, the states that have either passed the compact or have pending legislation, for people from those 2 categories of states that currently have licenses in Vermont, if all those people were to join the compact instead, the lost revenue from just that group is about $40,000 a year. Now, to go to the far absolute extreme is that if every one of our out-of-state licensees, if every state passed it, and every one of our out-of-state licensees becomes part of the compact, the maximum, that would be an additional $60,000. So the maximum impact that this could have would be about $100,000. So you'll see
Years, biannually.
biannual, correct. So So you'll see that my range is from anywhere from $2,000 to $100,000, but it's going to be in there somewhere.
Yep.
And we don't know it because it's so new that we don't know how many states are going to do it. By the time that we enact this, how many will be as far along, or, assuming we enact it. So that's that piece. So then on the application fee, now this again is annual, the application fees range from $4,300, and again, that's just the states that have either enacted or have pending, to $12,000 if every one of those folks, right?
Okay.
So you get the sense of the range on that. I didn't do a chart because it's so unknown at this
Yeah.
point. The point is that if we do this, there will be a fiscal impact, and over time, it will continue to grow and grow until we hit as much as $100,000 impact, based on that.
Okay.
Now, as we know, as I mentioned already, there is no practice to privilege.
Right.
So that we can't offset that with the $50 on this one. And then again, since this one, the way these at least with this one works, once you have 7 states sign on, then a commission can be created to make the rules, the regulations, and determine the fees. So, which when I spoke to the folks last night from the social work, or from the organization, they were anxious because they said, hey, if we're one of those first states, we get to help make the rules. So, but again, we don't know what that fee will be. Again, I expect it will be nominal. And then again, the final 2 points are, this has a fiscal impact to OPR. They will have some IT and staff needs to implement this particular compact as well. And they're saying it could be in the $10,000 range. So
I guess, what's our ultimate goal, what we want to accomplish, and what do you think this is going to look like in 10 years?
that's a policy question.
Well, we're pushing this, but.
So note, Logan, don't ever answer questions that you don't know the answer to, or policy questions.
So, and Lauren, feel free to jump in if you want. So, these are bills that have been introduced. There are, in these 2 cases, there is a social worker field and the occupational therapy field that has come forward and said, this would be really good for Vermonters to have access, as well as for the workforce to potentially much easier have multi-state license. So from a policy perspective, if we say, well, yes, that's what we think will help Vermont have access, then we should pass it. And then across the hall, they worry about how it's going to be funded. Let's remember, although the occupational therapy one is up and running, it would be a whole year. I think 2025 is the effective date, July 2025.
Fiscal year 26 would be
Fiscal year
the
26.
earliest for both of them.
So there's time to look at this. And then the social work one, you need 7 states. No, right?
This one was 7 states.
This one was 7 states. And so it isn't even active yet. So if we feel this is good policy for the state of Vermont, then we pass it out.
I think it's a good policy, but again, I think everything we do, there's a cost to it. Is the cost going to be beneficial to what we're trying to accomplish?
So there is a revenue loss to OPR. And so I would say we have to start rethinking how we fund OPR, because using fees to fund an agency that does regulation and consumer protection for Vermonters is not the best way to fund them. So we have to find a solution for that. I think we've heard from the testimony, and you all can take it individually for how you heard it, is that it is very costly and administratively burdensome for people to get licenses in multiple states. So we have to look at that cost too. So it's kind of this balance, right? So which one do we do? I don't know who was first. Go ahead.
No, okay, not a problem. This compact here, we would get a multi-state license. Is that correct? Isn't that what?
I think we're going to have Lauren answer. Lauren, can you?
I just want to try to figure it out here a little bit.
Lauren Lehman, General Counsel, OPR. for the record. Yes, so the social work one is a multi-state license, so you would get that in Vermont and then just be allowed to practice in any member state.
Okay, so everyone, all the compact states, the individuals would get their state's multi-state license. And that money for that multi-state license goes to the state they're in. Lauren, is that the way that would work?
That's correct, yes.
Okay, so, all right, so then I look at the loss here. Would that multi-state license be cheaper than our licensing today, or we probably don't know that, I guess, at this point.
I don't know that.
Yeah.
Yeah, I don't think that's something.
Well, just because maybe this all isn't a loss. I mean, it's a loss today, but if everyone bought a multi-state license, then that loss would be a lot less.
Right, yeah.
Okay, all right. That's all I want to know.
Leslie?
Well, I guess I'm thinking about the social benefit. This is obviously isn't a question for you, but something that's what I'm thinking about is what we gain by doing this. And there's just so many different places that we gain. And I know we need to think about what we're going to lose financially, but it's impossible to measure what we're going to gain in all those other places, the people who have access to therapists, who do end up doing better in their lives, who go back to work. You know, it's just this really a community benefit, social benefit opportunity. So I'm just thinking about it that way. That's really hard to measure, but it's sometimes hard just to think about the dollars and cents for OPR. I'm really glad you're talking about how to refund OPR because, well, working as a nurse, we want safe people.
Right.
That's important.
Exactly. Yeah, we have to remember that that is a big function of OPR,
Yeah.
is the, complaints about providers or things that may happen. Yeah, Melissa?
I just wanted to add that, you talk about the costs. What is the cost when Vermonters are not able to find a provider? Particularly, like I'm looking at the social work compact. What's the cost? We heard from the person at Rutland. They've had an open position there for, did you say years, I think? What is the cost to the people in Rutland who are unable to obtain or receive efficient services in OT because they can't find anybody? They're.
Yeah.
Well, make no mistake, I get why we're doing this, and I support why we're doing it, but I think we owe it to
Yeah, absolutely.
at least look at how this stuff all works.
Absolutely. Right. And if the committee across the hall, which is responsible for fees, doesn't believe it is something we should move forward with, that's where it stops. So this is the first step. Lauren, you're unmuted, so I didn't know if you had something. No. Okay. So there's also posted, and I just sent to you all an email. Last time we discussed this, Art and Alan wanted information about what the fees are today versus something like New Hampshire. So I sent that in an email just for you all to peruse. And then, I didn't send it. Lauren sent it. Thank you, Lauren. And then she put some links to, she provided what's needed in Vermont for OTs and OTAs for the paperwork piece of applying. And then she put a link to the New Hampshire OT license. So I'm not going to go over it in committee, but it's there for whoever wants to take a look at it. Thank you, Nolan, very much. That was helpful. So at this point, we'll come back to this tomorrow morning and have a committee discussion and then see where we are. And it's scheduled to be voted out and we'll see how tomorrow goes with that. And then it would, if it gets votes out of here, it will go to Ways and Means before it goes to the floor. Anything else on this subject? Thank you, Lauren, very much for joining us. Have a great day. Thank you, Nolan. Nice to meet you, Logan. Good luck. Okay, so the next thing we have on our agenda is reports repeal 2024. And so did we post the letter we got? I don't think we did, right? That's fine. I can read it. So this has gone out to all committees. And so I'm just going to read the letter that we got from Pledge Council. In 2 VSA 20D, the General Assembly established an intent to repeal certain reporting requirements after 5 years. And the law requires the Office of the Legislative Counsel to prepare a list of reports subject to repeal each biennium. So we will have a list that we will need to send to all of you if I haven't already. So I apologize for that. Get that out to you. So it is, and so this is what the statute says. It is the intent of the General Assembly that except for work reports required by interstate compacts, and except as otherwise provided by law, whenever an agency is required by law to submit an annual, biannual, or other periodic report, the requirement shall no longer be required after 5 years or after 5 years from the last date that the statutory or session law section containing the report was amended, whichever date is later. So basically, this is saying we can only require reports for 5 years unless we tell Legislative Counsel that we still need these reports. So we have a list of, I'm going to try and talk and send you an email all at the same time. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 reports on this list that I'm going to send you that we need to decide if we want them to be continued. I will say Nolan has already told us there's 2 that he uses all the time. And so we're down to 9.
Can we get copies of what?
I'm sending it to you right now.
But I mean, then we have to print them. Or you just need me look here?
If you want them printed, you can ask. Not everyone does printing, so you can ask Claire to print.
Right, you include me on that email.
So just shoot Claire an email if you want to print it.
And which 2 do you regularly use?
I believe on there is the expenditure analysis.
Medicaid.
Green Mountain Care Board. That one's very important to me. I know they're working on it right now. And another one was a Medicaid quarterly enrollment and spending thing, which I use frequently also.
Or both DIVA reports?
One's Green Mountain Care Board. The expenditure analysis is the Green Mountain Care Board. The other one's a DIVA report. They're both ones that I use regularly.
So I have to admit, when I looked at these, sorry, everyone who's doing these reports, I don't know what all of them are. So we, as a leadership team, decided what would probably be best is if we had a couple volunteers who would get together and look at the reports and use your judgment on what we know in healthcare and whether or not we still need these reports. So basically, we need to say, I just sent everything to you, the report is no longer useful and therefore not required. The report is useful, but not of permanent importance, and so we'll add this to a future review list, or these should always be required. And what I would say is we would put Nolan's 2 as always required, Daisy and then Alyssa.
I've got the DMH ones.
Okay, we're not going to talk about them right now.
No, I'm volunteering.
Oh, so the volunteering would be for all of them. The volunteering is, we have a couple people that come together and then say amongst yourselves, you'll take, however you want to do it. You can each take 3 of them or whatever the case may be, and then come back with recommendation. That would be the hope.
Just because I had a chance to peruse this list before, it seems like there's an awful lot of these on here that are really more human services ones.
Okay.
Are we being asked to repeal something? Are they being also given
Yes.
input?
Yes.
Okay.
Yes.
So we're not gonna get rid of.
No, nothing, no.
Dale
So
reports.
if the report goes to all, it has a column for who the committee it goes to, we would all need to provide.
Okay.
Yes, so if they need it, but we don't, that would be fine.
Nolan, you said the one in Green Mountain Care Board and Medicaid, are the 2 you need for sure.
Correct.
Which
Gotcha.
ones are those on this list?
What's that?
Which ones are those on this list?
One is the third one, the Vermont Health, oh no, sorry, it's the fourth one. Report on Medicaid program enrollments and expenditures, 2020, Department of Vermont Health Access. Fourth one down on page 1. And then.
Last one on page one.
Last one is, you
That
have
was the
board?
third one, well, so last time I did this, if you have a printed copy, it's different than an emailed copy. So we ran this problem we were going through the other day. But it would be 18 VSA 9383, 2018, Vermont Fair Board. It's in green, 2023. That's the expenditure analysis. That one's very important.
Didn't see that.
And therefore important to you.
So would you recommend extending it or keeping it?
What's the other column called?
You can make them permanent, I'd be happy.
Excellent.
I don't know if we can.
Nolan, can you do that 33 VSCA and
Yeah, I'll
all
show you.
that again?
Right here.
I got that one.
You got that one?
Yeah, I got that one.
And then it's this one.
That one right there.
Yeah. Do I have any volunteers? People to do this? What, Daisy?
Is all of those that are expiring? I feel like there's more of it.
It's all those that have been assigned to your committee
Yes.
by the GovOps.
So now we have 9 that we're gonna look at.
Yes.
I'll be happy to look at it with somebody else, if somebody else wants to.
Okay.
I'll do it with you.
Alyssa, Leslie, Art?
I'll help. I'll help.
Awesome.
So Alyssa, could we ask you to you're the organizer?
Sure, when,
That'd be great.
It is due to GovOps by next Friday, a week from this Friday.
Do you have another one of those papers?
Okay. You have another? So we can have it like, I don't know, Tuesday or Wednesday? Next week?
And can I make a recommendation?
Absolutely.
So I'm gonna, the folks that are doing this, I wish I could share my screen, but maybe Claire, so I'm gonna show you how to find reports.
That would be,
You would say, let's look up a report. But Claire, could you pull up the legislative website?
I know how to find reports. What I'm confused about is how to know how valid they are. Like, if it's a human services issue, how do I interpret?
You don't so if it's a human, so if you don't think we cover that topic in this committee, so it all pertains to healthcare. So all of these are coming to healthcare and they also may be going to human services. So we worry about whether or not, one, are we using it in here? Should we be, so maybe it's a report we don't realize we're getting and we should be reviewing it. So look at it from that perspective.
Yeah, just for example, just as the first one, report on complaints, conditions, and care in long-term care facilities. That's Dale. I don't know that we've ever looked at that in my fee.
Except for long-term health care.
Well, have we looked at, I don't recall.
So I would look at the report.
I'm just thinking about process.
Yeah, so look at the report, and if there's anything in there that you feel we should be looking at, if you really don't think it fits with our committee, then put the recommendation that we don't need to see it.
So,
Hold on, Nolan. Melanie?
Curious, because we have Nolan telling us what he needs to do his work. Are there other people that we should ask if there's things that they need to be able to access in order to help?
I would ask the people, good question, I would ask the people who are doing the report.
Okay,
Otherwise, Nolan would be really the main one for us.
okay. And Bill, that's a really question of you.
I see these dates, when it expires and one's 2018. Would that imply that no one's needed to update it since then?
no idea.
So what does that, what do
But-
they mean?
You'd have to ask the people who put the sheet together.
Yeah.
But to
Well, then who put the sheet together?
GovOps,
Tucker Anderson.
So, I have something to say about that. It usually means that it was enacted or last amended and updated 5 years prior to that. So it expires 2018,
So it's already been expired for 5 years, is that right?
possibly, or they just realized that it needs to expire.
Right.
This is the last year that they're gonna do it.
Okay, so
Exactly.
I get it.
Right.
And One thing when reviewing it is I've noticed a trend in legislative reports because I actually do read them. The last 2 years, especially, a lot of the reports coming out of some agencies, they're much more concise and direct folks to the scorecards or places where information is held online that's easily accessible to the public, which is great. But the reports are, I guess the content is really different than it was a couple of years ago. So I think there's an intentional shift, at least that I perceive, an intentional shift for information to be more broadly available to the public online versus in legislative reports. But that also means that, it feels like a transitional period. I don't know if that's true or not, but it feels transitional, which means there might be balls dropped. I would look out.
What's that mean, false drop?
Balls drop. So if you look, you'll notice it because you've seen reports for years. And if you look at the reports this year, they're 6 pages instead of 23 pages. Look at Act 79.
So if I can make 2 quick points that go to Councilman Carmen. Your point, the reports in the past when the committees have been asked to look at these, I remember them saying, oh, we didn't know we get this report. Yes, we want to get it, and they don't look at it.
Right.
And what happens is that I think it's good that there's a cycle because people are in agencies and departments are spending a lot of time writing these reports and nobody's looking at them. So keep in mind, I would encourage you to, and all the colleagues, like if you want the report to keep coming, you should make a point of trying to read the reports. Now, to that point, I'm going to show you how to find reports because this might be something that you might say, once a week, I'm going to go see what new report has been submitted to the legislature. So if you go to the website, then you click on research, report and research it, then you click on find legislative reports. And then scroll down and you'll see these are all, you scroll a little bit more. Okay, that's good, that's good. You'll see that there's just reports that are in the date that has been posted. And they're posted in order of how they've come in. Now, what's supposed to happen is that when agencies submit reports, they're supposed to send it to a specific website, a specific email address, and then it goes to Ledge Council, and then they post it. I will say that they're not always good about that. For instance, there was the most recent special funds report, which I just sent to Representative Black, is not on here. Because what happened was they submitted it to the Joint Fiscal Committee because the legislature said this report needs to be submitted to the Joint Fiscal Committee. Some of them might say this goes to Human Services and Healthcare and Appropriations. And so the person at that agency will just send it to those 3 committees and not forget to do this. So sometimes it falls short. But in theory, every report, even if it's supposed to go to PROPS, it should also go here. So this is a good place to find things. And if there's a report that is supposed to be annual and the most recent you find is 2022 or 2020, that means that they have neglected to send it. They may have submitted it to the committees, but they didn't submit it to the slings. That might be a recommendation you make to remind all agencies to do that. So I just wanted to show people how to find these because as you decide if it's worthwhile, you're going to want to look at it.
Yeah, exactly. And this doesn't have to just be the 3 people, Art, Alyssa, and Leslie. I mean, if I know Daisy, you probably have some thoughts on the DNH one, so share, the committee members, share your thoughts with the 3 main task people on this.
When you're searching for them, there was a search bar up at the top where it says refine results. You can type in there the citation that's in the left column of the spreadsheet, but the report will only show up if that's in the report name, and often it isn't. Often that citation will also, the department that submits the report will not have that statute citation in the title. They'll call it whatever the act name was, like I referred earlier to Act 79. The title of that report is down at the bottom, submitted on the 8th Mental Health System of Care Reforming Vermont's Mental Health System. That's Act 79, which I don't even think is on this list, but that's an example. So sometimes you might have to look at the statute, look at what act it was, and then look at the title of it. So there's a lot of detective work in it.
Yes, so if you type.
Sorry.
If you type in special funds, they're supposed to submit an annual special funds report, which you'll see the most recent 2020 on there. Again, but that's a way of searching too.
But if you type the citation and the statute number into Google, it'll show you which act it was and the title of it, and then you can just type that into the refined results search bar.
I think I'm just trying to find this very, very first report. on
Okay,
this
so we're
list.
gonna stop.
Okay.
Because we're not gonna worry about finding the reports right now. So the three of you can work with Nolan, who I'm sure will be happy to help you find reports if you can't find them. Alyssa, you're coordinating the group, and if you can come back on Wednesday with recommendations, this chart basically filled out, that would be awesome.
Can you explain again the five that we're looking at?
We're looking at all of them,
Okay, we're looking at,
all of them, yes. Yep, we just know that already two of them Nolan wants to
Okay.
keep. Yeah, but we're looking at all of them.
Is there anyone else we should ask who would prefer to keep them?
Why don't you work with Nolan on that?
Okay.
That'd be great. Nolan, you don't mind, right? Helping? Okay, of course not. Awesome.
He rolls his eyes.
Roll any.
Just saying.
All right, so we're gonna keep on the topic of reports. I sent you all a bunch of reports this weekend because basically when I get them, I'm just gonna forward them on. And what seems to be happening is that I'm getting them as chair from the agency, and then a couple days later, they are actually getting on that legislative page. So I'm sorry if you've gotten duplicates. But Claire is diligently working on our schedule for next week. And so what I want to do is alert you to a couple of the reports that, if you have time, would be helpful to peruse before our testimony next week. So one is came from DMH, and it is the Mental Health System of Care. I'm going to go to the webpage and, but it's in your email, would have come from Nicole. What is it?
I think they
Thank
all
you.
came from you.
I'm choosing.
Oh, yeah, I'm sorry, it came from me, but then it went from
So
Nicole
we
to
look
me.
you up.
Look me up.
Yeah.
Yep. So it's the Mental Health System of Care. And so we're going to have DMH in hopefully next week to, not only DMH, we're going to have Vermont Care Partners, DMH, a couple other agencies to walk through all of the programs that we funded last year, like alternative CEDs, mobile crisis, CCBHCs, to get an update. In this report, I only briefly went through it, but it really is a very good report talking about the mental health system of care. So that would be a good one to read. The other thing that would be important to read, and it just came out today from me, it is not a new report, but Nolan sent it to me, and it's called the Vermont Department of Corrections Assessment of Healthcare Systems Cost. So this was a 2019 report that was done to look at healthcare in the prisons. The Vermont Department of Corrections Assessment of Healthcare Systems Cost. And then the other report that I have on my list that we may or may not have next week in testimony is the Mental Health Integration Council final report.
Mental Health Administration.
Mental Health Integration Council report. So those three. We did get a report on the suicide prevention strategic plan. We'll get to that eventually, but that's out there. We got an Act 51 report. If you remember, that is the report where we asked AHS and Blueprint to look at their funding and come back with suggestions. That is something that is going to be taken up in our center counterparts first. So You can put that on the lower part of the list to read unless you're excited about it. It's actually a very good report. And I think, oh, and we had a health equity data report that came through, and we will eventually get to that, but that's not on next week. Does that help? I don't even know if there was a problem, but I figured going through all the reports, someone's probably like, stop sending me all these reports.
No, I appreciate it. So, yeah.
I'm curious, is the 2019 healthcare in prisons the latest data that we have on that?
That is the, Nolan help me out, that is the last time
We looked at it.
we looked at it. Now, there's new data, but that's the last report. We can, what I'm going to do is I'm going to go through that report and then come up with a list of questions of what I want refreshed, if there is any data refreshed, but does that help? So like, that's the last time we looked at it, but of course there's new data since 2018.
Just so you know, there was legislation that required us to hire a consultant to do it. That's why we did it.
Yeah, I'm just thinking because we did some work over the
So
fall, yeah.
And the Joint Justice and
Right.
Oversight Committee, yes, so that's another place. And we're going to talk about healthcare in prisons a little bit later, so let's bring that up. All right, any questions on any of that?
The blueprint report that you sent,
Mhm.
is that, you sent all the way back in November?
No,
Okay.
there's a new one.
There's a new one?
Yeah, Act 51. It's on the legislative website if you can't find it. It's a very good report. All right, we can actually take a break until 2:30 when V&A, Jill Olson is here. So just be back a couple minutes.